Hey, Dr. Lindsey and Wendy here. This is just a little quick summary of a Middle Eastern guy that's 48 months out, 48 months and 2 days out from us doing a repair case. And he's a typical one of these guys that was sold a bill of goods at a national chain where they said they'd sprinkle a little hair all over and it would solve all his problems. And soon enough, time went by and he'd lost some hair, and this is what he looked like. And it's just a little bit of hair around the edges and not enough to really make a difference. So we trimmed him down, and you can see that he's paid for a number of grafts, maybe not the number that he thought that he got. And there's just a lot of space between, right, Wendy?
There is. I think this is the perfect example of you can definitely see which are grafts and which ones are not. And it's a perfect example when patients go and get hair in between their original hair. They think that solved all their problems. But as the time goes by,
had he have come here, we probably would have told him either he's not quite ripe for
it's
surgery,
not ready yet. Yeah.
or would have said, we'll do it, but we're going to shave you down and pack you as if you're already bald in that area, so that the density would have been enough that he wouldn't have had to come back.
Yes.
But in any case, you can see now in this view where we've trimmed him down, and Wendy and the other girls have inserted the grafts, and the grafts aren't homogeneous. There's some spots that don't have any grafts, and that's where he had hairs
that he paid for before. Yeah.
And so then, although he's a medical researcher at a major university on the East Coast, we didn't hear from him until about 3 days ago. And then he said he wanted to come up and to stop by. And so he came in, and we took a video. He then decided he didn't want even the images on there. If I can cut out the audio and put in, I will, where he talks about it was
how happy he is. And yeah.
But I'm not sure I know how to do that. But in any case, here's his picture now at 4 years and 2 days out from his procedure, and he looks really good.
He looks awesome. Yeah.
And his wife is happy, and that's, again, probably the more important thing, that the wife likes it. And then we cut out his old scar, and his current scar is perfectly acceptable.
Yeah.
The little picture here shows my thumb, and it's a fine line, roughly a millimeter wide. Not too bad and he's had somebody else and then me. So in summary, if you're going to get a hair transplant, plan for the future. Maybe if you're not quite ripe, put this off and make sure you know what you're getting rather than just sprinkling a little hair all around. If Wendy and I can help you, please give us a call. Thanks.